Hello and welcome to another episode of Qatar Stories. I'm Anu, your host. Well, today's episode is really different, and the biggest difference is in place of watching me, you are just listening my voice. Why? Simply because of the ongoing global health scenario, because of COVID 19. Lots of restrictions are there, and all these restrictions are for our betterment, for our safety. Government here in Qatar is trying their best to limit the infection, limit the spread of COVID 19. And that is why we support all of their efforts and we support social distancing. We received many queries from our viewers, and they were a bit worried about Indian nationals. They have certain questions which they wanted to know. So we thought that we will find out all of these answers while maintaining social distancing. And to find out all of those answers, I tried to speak to His Excellency Shri P. Kumaran Indian Ambassador to Doha, Qatar. Let's hear what he has to say about COVID 19 and about all the preventive measures which Indian Embassy is taking to prevent its nationals.
So right now, to address more on this issue with me over phone line is His Excellency Shri P. Kumaranji, Indian Ambassador to Doha, Qatar. Hello, sir. Welcome to Qatar Stories.
Thank you very much. Welcome to you. Very nice to speak to you again, and my good wishes to you and to all the members of the Indian community here.
Thank you so much, sir. Thank you so much. Well, we know the kind of situation we are facing, and that is the reason why we are talking over phone. But we know, sir, when we talk about Qatar, we know that in Qatar, Indian population is here in huge number, right? But
Yes, Indian population is currently about 750,000.
750,000, that's a big number.
Yes, it is.
So if we talk about the current situation regarding coronavirus, regarding COVID-19, so what is the status here in Qatar right now?
Qatar has currently put out information saying that there are about 500 cases, about 40 odd people have recovered, and there have been no deaths till date.
Yes.
But we have no clear estimate of the number of Indians who are affected by this. Because the Qatari authorities are not sharing country-wise information of the number of people infected.
Right.
For their own reasons. They are saying that it can cause difficulties among the communities. It can probably cause some kind of difficulties for the people who are affected, because even after they recover, they may not be able to normally come and mingle with the community because of improper understanding of the recovery process amongst the members of the community. They are saying if the infected persons want to share the information, they are free to do so.
Okay.
But the Qatari government would not do that on its own.
Right. And I think the reason is very much valid as well, because unfortunately people don't understand the seriousness of this problem, and the infection is spreading very frequently. But keeping the overall scenario in mind, and as of now you have already shared that the Indians are here in a huge number. So if we talk about Indian Embassy in particular, what all arrangements Indian Embassy have made for the nationals, for Indian expats if we talk about specially?
Sure. We have set up a 24/7 helpline
Okay.
for all members of the Indian community. The numbers are given out on our website, and we have also tweeted those numbers.
Right.
It should be easily available. If you want the numbers, I can have them sent to anybody. We can, but it is available all over the community. It has already been publicized. A lot of people are already calling in.
Right.
So that is one. We've also publicized the numbers of the central COVID control room in New Delhi. That is also on our Twitter handle and on our website. We've also put out extensive information on the travel restrictions applicable for India. As you know, India has gone since today into a 21-day lockout. Therefore, no international flights connect India to any other country, including Qatar. We are also talking to the Interior Ministry people in Qatar to help with extending the visas of people who are stuck here because there are no flights connecting Qatar with India.
Right. And this is somewhere down the line bothering lots and lots of people. But sir, as just now you mentioned about the helpline. So can you please share the helpline number with us as well, so that people who are watching us, who are listening you right now, maybe they can have this helpline if they have not received it yet?
Okay. There are 4 helpline numbers. Let me read them out to you.
Sure, please.
There is a landline number which is 44 255 747.
$44255-747.
747.
Right.
And two mobile numbers on which you can either make calls or send WhatsApp numbers.
Mm-hmm.
5566
5566
7569
7569
and 5564
5564
7502.
7502. Perfect. So basically there are
These numbers are all 24/7. I also have an extra number, which is the number of our second secretary, Dr. Sona Soman. She has another number, but we hope that she would not be available on a 24/7 basis, obviously, but except for emergencies.
We do understand.
But during almost from 9 o'clock in the morning to about 8 in the evening, she'll be available. Her number is 3348
3348
4669.
4669. So, sir, I'll just repeat all of these numbers. Basically, there are 4 helpline numbers which Indian Embassy have issued. The first one is a landline number, which is 442555747. Rest two are the mobile numbers, which is 55667569. Another one is 55647502. And the last number belongs to the second secretary of Indian Embassy, which is Dr. Sona. And she herself is trying her best to be available on this number at maximum point of time. And her number is 33484669. Am I right, sir?
Absolutely. All of them are right. In addition, there are numbers available for the Central COVID Control Room in Delhi. Those are available on our Twitter handle. Anybody can refer for things that do not necessarily relate to Qatar, but relate to the larger number of measures adopted by the government of India. This control room may be able to help.
Definitely, sir, definitely. But, just 2 minutes back, you mentioned a very important point, that people who are struck here. And somewhere down the line, when you hear, because right now the world is in a very strange, in a very bad shape, in a very bad scenario, and every time you're receiving is all negative news, right? So, God forbid, if there is any sort of emergency, so is there any contingency strategy in place for Indian community in the wake of any emergency here in Qatar? Is there anything like that you're working on?
We have a WhatsApp group that combines or brings together all the Indian community associations. As you know, from your own experience, we have about 125 Indian associations here.
Yeah, very true.
We formed a WhatsApp group to coordinate any information that anybody gets, automatically gets shared with all the other associations and the key nodal points in the embassy, including to me and to Mr. Rajesh, who is the Council of Community Affairs.
Right.
And these nodal points in each of the associations share it with their full memberships. Making sure that information spreads seamlessly into as many people as possible. All the associations from various states.
Right.
So that's important. A lot of Indian doctors and counselors and other professionals, healthcare professionals, have come together. They have offered themselves as volunteers to give advice on any coronavirus-related symptoms and any other advice that people need. We are circulating that also, and it is very kind of these doctors and other professionals to come forward and offer their services free of charge to help advise how to find out whether you may be affected by a corona infection and how to deal with this, what to do in a quarantine situation, what kind of precautions to observe, where to go for treatment, and all these questions. They're very, very, as you know, we have a very, very responsive community here.
Very true.
Works closely with the embassy. And I'm very happy that our professionals are coming forward and offering this kind of help.
That's something.
So that is one. But there is a lot of unnecessary panic also. We need to be cautious. We need to do our very best to ensure that infection doesn't spread. But for persons with normal immunity and no pre-existing conditions, there is no need to panic. Even if you are infected, your immunity should be able to fight it off. If you observe the precautions, go through the treatment, it is not something that is very, very unusually scary.
Very true. I think this is what is required at this point of time. The most important thing is to be very positive, stay relaxed, calm, and at least try to make sure that there is no, you can say, negative news or unofficial news or any story like that sort should not go out either from your end or from the people. I think this is a very important point.
Absolutely, it is good to know about the disease so that you are prepared in terms of how to deal with it. Do not go by advice that is unconfirmed or by people who are not authorized to give that kind of advice.
Right.
It is important to stay calm, do your exercise, do your yoga and whatever other...
within your house, of course.
Within your house, clearly, because social distancing to the most extent possible is very, very important.
Very true.
But to keep your immunity working at optimal levels, it is important that you do exercise regularly or your yoga regularly without getting into larger crowds. Do it alone if you can, or with maybe one person to help you motivate and give you company, but not in large groups, clearly. But it is important that your immunity is maintained optimally. Have a normal diet, healthy diet, to make sure that immunity levels are maintained well.
Yes.
That will actually help you deal with any infection much better.
Absolutely, truly agree. And as you mentioned, sir, just to maintain this calm, so that people should remain positive, calm, and they should not trust on any other unauthentic source of information. What message, appeal, or assurance would you like to give to the people who all are listening you, who all are watching you?
My main advice is to listen to what doctors are saying, listen to confirmed advice given by the WHO, the Indian Council for Medical Research, and any other confirmed source, Johns Hopkins University experts. And there are a number of videos that are authentic and from confirmed sources. Listen to them as much as possible, or listen to doctors you trust here. We have a number of highly qualified doctors who work in Qatar. Prepare yourself well. Avoid mixing with people as far as possible. Stay at home. Take care of your family. Spend more time with them. Keep yourself in a good frame of mind. Eat healthy food. And don't worry if there is an emergency. We are all there. The community is there. The embassy is around. Don't worry if there is an emergency. We'll be very happy to step in and help to the best extent possible. But it is more important not to panic and to trust the system to take care of your needs. Unfortunately, at this time, travel is not possible, but it is in the interest of everyone that people don't travel from one country to another or one area to other. The whole idea of a lockdown in India is to try and ensure that the current focus is maintained on minimizing community transmission.
Very true. Very true.
If more people keep coming in from outside, half the resources or a fraction of the resources will be diverted more towards ensuring that those people are quarantined and they don't go around spreading the disease more into the community.
Absolutely.
The idea of a 3-week lockdown is to ensure that you identify people who may be infected, separate them, make sure that the larger community is protected from large-scale transmissions. It is very important. So unless there is absolute emergency, you should not even try to look at options for travel.
Very true. This is really very important, and this is what people should need to understand. But sir, the kind of profession you are in, the kind of responsibility you're handling, especially at this crucial stage, how you are trying to maintain social distancing, because you have to, in this crisis also, I'm sure you must be meeting so many officials, ministers here in Qatar, going out, because people, whenever there's any problem, they always look up to you. So how are you maintaining your social distancing in this crisis?
It's very interesting that you asked this question. I have myself minimized all meetings. It's very surprising. You look at my calendar, it is absolutely empty.
Oh my God.
It's surprising. I've never seen my calendar like this for many years now. Even the Qatari authorities and my colleagues from other embassies, all of them have minimized interactions. There is absolutely no meeting now. All of us do our work on the phone.
Like we are doing now.
like we are doing, absolutely.
Right.
In fact, that has become the new normal.
Very true.
I talk to ambassadors on the phone. I talk to Qatari authorities on the phone. I'm very, very happy that they are very accessible and continue to help us just on the basis of phone calls. We continue to send messages also, formal messages, but these go by fax. They are not even physically delivered. We get messages also by fax. So we found a new way to deal with each other, work and carry on in such a way that our normal work is not affected. At least the urgent parts of the normal work. So it is very important. There's no exception for anyone. I need to keep myself in good shape to be able to provide the best possible help to the community.
Yes.
So I have to do social distancing myself. The embassy itself is working on a skeletal basis. We have reduced our consular services to the barest minimum.
Right.
Nobody can come for consular services without an appointment. We have given helplines. The COVID helpline numbers I gave you are in addition to the two consular helpline numbers. People can call them, set up an appointment, explain why it is urgent, then we receive them, and a small number of people are deployed in the consular section to provide those services. The other wings of the embassy are also working on a low strength basis, and we are also coming in and making sure that the embassy is working, but on a very, very minimally required basis for the next 2 to 3 weeks. We will continue to review this on the basis of need. We have people who talk to us on the phone. I get feedback continuously from community sources to constantly review and calibrate the kind of presence that is required in the embassy.
Thank you so much. And अगर जरूरत पड़ी तो हम आपको फिर bother करेंगे.
Thank you very much, and stay safe.
Thank you, sir. Pleasure talking to you. Please take care. Bye-bye. Bye.
Pleasure. Thank you. Bye.
So this was His Excellency Shri P. Kumaran Ji, Indian Ambassador to Doha, Qatar. And for more updates, you can follow Indian Embassy to any of the social media handles. And before I wrap up today's episode, the key factor or the key learnings of today's episodes are: number one, first of all, make sure that you practice social distancing. Doesn't matter whether you are at home or you are going out, you have to maintain social distancing. Point number two, follow best of the hygiene practices. Yes, and regular hand wash is the most recommended one. And point number three, which is the most important one, is stay calm, stay positive. If at all you have any symptom, simply visit your nearest doctor, health center or hospital. They will take good care of you. Well, that's all from me. It's me, Anu, saying tata, goodbye. Take good care of your health. And in case if you have any other concerns, if you want to know any other things, simply write to us. That's all from Qatar Stories. I will see you again. Till then, take good care of yourself. Be happy. Stay healthy. Goodbye.